Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and today we're going to talk about a brand new non-surgical alternative to gastric bypass surgery. And if you haven't watched my gastric bypass surgery, first I want you to go ahead and watch and understand what gastric bypass surgery is, or go online and look up gastric bypass surgery images and understand the anatomy of what happens with gastric bypass surgery. So this new technique called MetaboShield, or the gastric sleeve. And let's draw a picture of the upper GI tract first. And you've got your esophagus, the swallowing tube, your stomach is here, and this is the duodenum, the first part of the intestine, and then the jejunum below that. With traditional gastric bypass surgery, we make an incision and we cut away and make a small pouch in the upper stomach and then attach the lower intestine to this small pouch, bypassing the stomach and the duodenum. And there's some specific benefits to doing this. With this new procedure called the gastric sleeve, it's actually done endoscopically. So you are put to sleep, they pass a fiber optic camera into your stomach, and they place a gastric sleeve. And this actually looks like a condom, and I've nicknamed it the colon condom. This sleeve is inserted in the distal portion of the stomach, and it is a plastic tube that goes into the duodenum and it empties out in the jejunum. So food that comes into your stomach enters into the gastric sleeve. It is protected from absorption and digestion in the duodenum, and the food actually exits in the proximal jejunum, where digestion starts at that point. This mimics the gastric bypass, where the food is taken from the stomach and presented. So the things that happen is it blocks some of the absorption of food, so you don't absorb quite as well. And this interesting GLP-1 effect that we talked about, when food is delivered to the jejunum instead of the duodenum, that stimulates a hormone called GLP-1, which increases insulin release. It slows emptying of food from the stomach. It increases satiety, tells your brain that you're full, and it helps you lose weight, and is actually a diabetic medication. There's 3 of these called Byetta, Bydureon, and Victoza that are taken as injection medication. So instead of taking a prescription medication, instead of having gastric bypass surgery where they cut your stomach apart, disconnect it, and attach it down to your jejunum, we have an endoscopic procedure where this sleeve is placed in the distal stomach and anchored there and empties in the jejunum. Because of the curvature of the duodenum, the C shape helps this tube stay in place and it doesn't migrate or move. It apparently does not cause any injury or irritation to the lining of the intestine. If you have a problem with it, or you've lost all the weight that you want to, they just go back in endoscopically and pull the sleeve out, and you're back to normal, as opposed to gastric bypass surgery where they would have to rearrange the organs with a major surgery, or lap band where they would have to go in with the laparoscope and take the band out. So minimally invasive, easily reversible, similar perhaps benefits to the gastric bypass with its GLP-1 effect. It does leave a full intact stomach, so you're able to eat larger quantities. So the biggest difference would be with gastric bypass, you can only eat a very little amount before your stomach is full. This one you still have the full stomach, but it's an interesting alternative and likely due to this GLP-1 effect. Dr. Greg Castello, thanks.